Well, first of all, thanks for the opportunity to share some thoughts with you, and I really congratulate the committee on getting that framework done in the period of time that you had on the staff to do it. I found it quite comprehensive and thoughtful. I was told that I should introduce myself briefly, especially in terms of potential conflicts and disclosures that I might have. I'm currently at Georgetown University, where I head up the program in regulatory science and medicine, and also we have a Center of Excellence grant from the Food and Drug Administration that I head up. And as far as disclaimers goes, I usually have to start that nothing that I say represents anything from the FDA or the IOM. It's just completely my thoughts. I should point out that I do head up a not-for-profit organization of researchers, clinical investigators in the area of Huntington's disease, for which I receive no compensation, but I do consult for a variety of companies, foundations, and academic institutions. Happy to provide that, and just threw in this piece from Joseph Stiglitz that all knowledge is based on prior knowledge, and by making your knowledge less available, innovation is impeded. And I think that's a very thoughtful comment, something that we would agree to. So I just point out that prior to coming to Georgetown University, where I've been for the past 3 years, I was at the University of Rochester for over 3 decades in the capacity as a data generator, data sharer, and most recently a data user of other people's data. And just that perspective I found to be interesting. Little did I know, as I began to be a data generator, overseeing multiple randomized controlled trials where over 5,000 individuals were randomized collectively under my watch, and another 5,000 in observational studies, that data sharing would be part of that. At least when we started out, I had no idea what a data dictionary was when we started out, and all the requirements and obligations for data sharing. So this obviously has been an evolving piece for me and for many others. So this type of model that we're talking about, I point out that all the 4 models that are here today, obviously out of convenience, were categorized, but there is a real continuum in these models. There's no doubt about it. And I'd also point out that the open data sharing, while I think has a lot of great appeal, especially to me, is been largely applied to observational studies and to non-randomized controlled trials, although I was very interested in this recent effort at NIH in the area of rheumatology to look at all these trials. So essentially I look at this as kind of like a gated community. You drive up to the gate, or you're on your bicycle, or you walk up, and there's different rules for getting in. Each community has different access to it, and it ranges from nearly open, not quite as open as we've heard, to that which is highly restricted, and it could be restricted in terms of content, or it could be restricted in terms of timing. And it also could be staged in terms of, if you do this, you get the next piece. And much of this gated community also could be restricted in terms of intermediaries or data aggregators or honest brokers or trusted intermediaries that are part of it. And also the data that one can have access to in theory could be detailed, highly detailed, obviously de-identified, and participant level data, or it could, on the other hand, be highly pre-specified, as one does ahead of time in a clinical trial. And I also mentioned that in clinical trial research, when those are done, there are pre-specified analyses that go into it, which is really the focus of the major publications. Most of the other data that emerges after that is secondary types of analysis, observational types of analysis that I think are very helpful. So I clustered the benefits and the risks together because each benefit, of course, has a risk to it. So controlling access to the shares and data and timing is certainly a benefit, but has its downsides. It imposes obligations on the sharer, much more so than one would see in open data access. It helps protect intellectual property. It may even, ironically, mitigate liability because it forces the disclosure of a lot of information that, if it would come to bear later on, might have some liability that was actually disclosed earlier on. It helps maintain participant privacy, recognizes the data generators, can track use and outcomes prospectively, and of course contributes to the public good. So I think the heart of this is, what are the really challenges of this? Well, one big challenge that we haven't quite overcome yet is the issue of standardization. I don't think we should minimize what's involved in terms of standardizing data, at least being able to understand what kind of data are being accessed and the procedures for analysis. As one restricts these models from open to more gated types of models, there's a whole issue of policing the policies, and the data use agreements can become very extensive. A big piece that we've been interested in is the cost of data sharing, and not just in dollars and cents, but in terms of human resources that I'll talk about later, but able to identify them. Tracking the outcomes of data sharing, I think, is something really important that's been relatively neglected. It was alluded to in terms of what are those types of outcomes. And I just point out, this came up before a topic of discussion, that living with the reality that data sharing is imperfect, and it's going to lead to seemingly invalid analyses or rogue science and publications, and this will take time to correct, and some of these may take a long time to correct. So I just want to close with a few other challenges and some observations, that this whole area of data sharing is obviously a new field, as I pointed out from my perspective, and it's an evolving field of scientific endeavor. And as we become interested in data sharing in our center, it struck us that there's really a lack of empirical data about data sharing, and there's few research on attitudes, beliefs, and positions, but not a lot of empirical data. So we're very interested in this. I predict someday we'll have the Journal of Data Sharing, and that we will be able actually to concentrate on a lot of this. Maybe it'll be a good opportunity to publish some of these derivative analysis. And so I just conclude that there's a major unmet need to prospectively accrue and examine data about data sharing in these models, and all that's involved in terms of their goals, methods, and outcomes. So I'll stop there.